Hi, I'm Dr. John Lenihan, robotic GYN surgeon, now working with Mimic Technologies in Seattle, Washington. And I have today a guest surgeon we're going to talk with, Dr. Gianluca Torregrossa, who's a clinical associate professor of robotic and minimally invasive cardiac surgery at the University of Chicago, and a very active member of the Society of Thoracic Surgeons, the European Associations of Cardiothoracic Surgery, and the American Association for Thoracic Surgery. And Gian just gave a really nice presentation at the recent Society of Robotic Surgery annual meeting last weekend. So I thought it might be good to chat with Gian. How you doing today, Gian?
Thank you. Thanks a lot, John. I'm doing very well. Thank you for this opportunity to speak and to share some of this enthusiasm that I have and we have about robotic surgery and the future of robotic heart surgery.
Good, and I want to compliment Gian. He was up all night with an emergency transplant, so he's really speaking now with his internal organs kind of functioning at max capabilities. So hey, I was around when the robotic surgery started, and it was originally designed as battlefield surgery for cardiovascular use. And I remember in my hospital, we got urology and GYN going very easily, but the cardiac problem surgery was a big problem. It was too hard to do, and they were always complex patients, and the surgeons were training on each patient, and that became too much of a liability. So it kind of fell out of favor. Now at the University of Chicago with you and Dr. Balke and others, you're really pushing robotic surgery back into the forefront of the approach for a lot of cardiac surgery options. You want to talk about that? What's different and how that works now?
Yeah, it's an extremely interesting question. It's a very good question. You're right. The reality is that when Intuitive came to the market, the major interest was robotic cardiac, and actually the major interest was coronary surgery. Right now, if you look at the STS database, the amount of robotic cardiac surgery performed in the United States account for probably less than 2%. And the amount of robotic coronary surgery is less than 1%. Wow. So for sure was not a success. We were not able to establish as a clinical practice as instead has happened for different specialties, urologies, OBGYN, as you know very well, general surgery. They really embrace the benefit of the robotic approach. It is true that there is a technical challenge that heart surgery has always been among the most complex type of technical skills to acquire. And what is different now respect of 20 years ago are mainly three things. The first is that we have a better level of technology. The robot that was present 20 years ago is very different than the robot that is present right now. The view, the 3D perception, the feedback, the ability are completely different. The second element is that we have a different generation of surgeons. And after the generation who was sitting at first on the robotic console at the end of 90s was a generation of excellent surgeons, extremely well trained, but with a very minimal background in video games, in connection between your eyes and your hands that are looking somewhere else. My generation and the generation previous to mine instead has a completely different background. And this is a true statement that can be also been seen among general surgery and the approach and the outcomes of laparoscopic surgery. So a generation that is trained and has grown up with hands that moves joystick while your eyes are projecting to a video or are looking somewhere else, create a level of hands-to-eye coordination that was not present at the generation that at the end of 90s tried to apply the robotic heart surgery.
Yeah, I'm afraid being one of those older surgeons, you're absolutely correct.
The third element that is different is that we all, as cardiothoracic surgeons, understand that we are facing one of the most important changes among our practice. The push of transcatheter devices that is so well sponsored by the industry is now making the need of applying heart surgery and the excellent results of what we have done and what we still do in an open fashion through big incision. We need to maintain these quality, excellent long-term results for our patients, Absolutely. But being less invasive. That's the word.
So what's the key to teaching this? I mean, you like in the past, again, the cases were long, the learning curve was very steep. How are you and young surgeons moving this forward?
Yeah, I do believe that robotic cardiac surgery is an acquired skill that need to be acquired by the heart surgeon in a certain specific time of your own career. It shouldn't be too early, because the risk is that at first you need to know how to approach a mitral valve. You need to know how to do a bypass in a more traditional way, but it can't be too late when you have already established yourself in a practice and it's very difficult to acquire any new skill. So there is really a window that is generally after 3 or 4 years after your practice, where you can start to think and acquire this type of technology, this type of skills. Acquiring them, it's essential, done by a center and by a mentor who can really teach you and is willing to do so.
Yeah.
And that's another key element of what is different now than 20 years ago. And the second element that of extremely important is to adapt one of the training simulators that are available right now to make sure that your learning curve is not at the bedside of the patients, but is in your office at the backside, on the back of the table, during the afternoon or during the evening. And this is what I personally do, and I'm still doing it.
Right. So you've highlighted that you shouldn't go right into the robot surgery and to know how to do the surgery first. And then being really skilled on the robot by practicing on a simulator, then you can go in and apply those skills to a live patient, which sounds like it would be better, for the patient outcomes and for the operating room in the hospital itself.
Absolutely. So the surgeon needs to first be a surgeon, and to be a heart surgeon, he needs to know what is he doing. Unfortunately, too frequently, people that were very enthusiastic about robotic heart surgery start to sit on the robot, start to be proficient on robotic surgery, but that they couldn't perform a proper mitral valve repair, for example. So first you need to have a solid background or on the type of procedure that you want to apply, and then you can embrace robotic.
We saw that clearly in OB/GYN, where the robot does not make a bad surgeon a good surgeon. You have to be a good surgeon first. And the robot is another really good tool if you can practice on it.
Exactly. And this is absolutely the best line. The robot just doesn't change your skill. It's
Right.
just minimize the type of burden you do to the patient, but your knowledge, your skills, your ability, your judgment needs to be at a very high level, particularly because now you are even making the complexity of the surgery somehow one division standards above the mean.